And then diagnosing depression. So Stanford University is doing, not surprisingly, a lot of AI research. And they're using Instagram photos. Okay, so not only can you show the world what you've eaten for lunch on Instagram, but now Instagram is actually being used for medical purposes. So they've analyzed 44,000 images, fed it into the learning model, and they're able to detect through physical presence, through imagery, whether someone is more likely to suffer from depression with 70% accuracy, far greater than that of a general family practitioner. Okay? Diagnosing depression, they're also using voice analysis as well. They're finding that people pause more often between words. They speak much lower. So again, a much more superior way of diagnosing depression. Detecting deadly malignant melanomas. Trained the model using 130,000 images. 21 dermatologists were the control group. And again, they've actually got higher levels of accuracy. So pretty much across the entire care continuum. And of course, they're working on ECG and cardiology and irregularities around the heart. And they've shared their data with Apple, and that's why Apple has the kind of positive outcomes that we've read about. Okay? And then finally, pneumonia. Okay? And so there's just an infinite number of examples I can share with you, but these are the ones that I thought would be most interesting. Okay? And let me just talk about one from an operational excellence point of view. There's a company known as Cogito, C-O-G-I-T-O. Cogito spun out of the MIT Media Lab. And Cogito is being used today by Humana Health. And what Cogito does is it analyzes in real time the interaction between the customer-facing contacts, people that are responsible for managing day-to-day, their telecenter. And what they're able to do is detect the nature of the discussion and in real time give them cues, emotional intelligence cues, that will allow them to be more effective in how they're interacting with their clients. This has been rolled out across the company. I've got them coming in to talk about this case study in a class I'm teaching this Friday. And they've been able to increase customer SAT scores by 700 basis points. They've improved their net promoter scores. So this is another product. It's not at the point of care, but it's also something used by a large health insurance company to dramatically improve their operational excellence in a specific area of the business. Okay? And then I'm going to leave it up to you guys on this one. What was the name of this company, Julie, that I asked you about last night? Yeah, Change Healthcare. So Change Healthcare is based in Nashville. And when Stefan and I were talking, right, they had come out and said that they're using artificial intelligence to be able to determine whether people had double admissibility for health insurance, Medicare and Medicaid. And so they claim that they're using artificial intelligence to help them make much more rapid decisions. The question is, what really is the applied behavioral science and some of the other data that they're putting in the system. But I think the message is clear. This is not some pie-in-the-sky dream. This is being used very effectively today across the entire healthcare continuum, okay? And then finally, with 5G in the hospital, we're going to see a lot more technology. So Verizon is partnering with some companies to, in the hospice environment to help mitigate pain of late-stage hospice patients. And finally, what they're working on is the ability to visualize cancers in the body before they operate, okay? And again, 23andMe, GSK, one of the world's largest pharmaceutical companies, just invested $300 million. The size of the data set, the largest in the world, says that you can reveal a lot of signals. So there's a 4-year exclusive partnership to identify new drug targets. And they're starting with Parkinson's disease as their first target. Okay? So let's quickly shift and wrap this up. So how do you prepare? How does any organization prepare for disruption? Okay? Certainly not the way Blockbuster did. In fact, just the opposite, okay? The way you prepare for disruption is you have to be very disciplined and very strategic about it. And you have to recognize that innovation is happening all around the world with you or without you. And the more you are willing and able to collaborate with the innovation ecosystem the more it will inform and inspire and challenge you to take your innovation capability to a whole new level, okay? There's a lot of different underutilized digital innovation practices, including crowdsourcing, right? All kinds of things, hackathons being a great example. The ability to really understand how you finance innovations, right? Because you've got a bunch of emerging ideas, but they have to compete for funding with the core business. These are things that a lot of companies struggle with today, okay? But using the crowd as an innovation partner pays off, right? How many people have an Alexa at home? How many people get an email every week that says, we want to introduce you to all of Alexa's new skills? Those new skills are crowdsourced skills. It's an open platform, and every week a bunch of developers are building new skills on Alexa, and Alexa has blown by Siri like it's standing still, because Siri is all about, we own Siri from Apple. Alexa's got 100,000 skills, and it's growing exponentially, okay? So how do the most innovative companies in the world do this? They bridge to innovation ecosystems. Johnson & Johnson is a great example. It's a 100-plus-year-old company, but they are a global collaborator. They have set up innovation labs all over the world. Their chief science officer, Paul Stoffels, our goal is to bring forth highly differentiated healthcare solutions that extend and improve lives. To do this, we collaborate with innovators and entrepreneurs all over the world to advance the best science wherever it exists. And they engage in no strings attached collaboration. Okay? One of the companies that came through the J&J labs was Winterlight, the one that did the early Alzheimer's detection that I spoke of. They're constantly putting out new challenges, new hackathons. So the Metabolic Disease Innovation Hackathon, the Quickfire Challenge on perioperative nursing care. This is what world-class companies do. This is how they drive their innovation agendas on a global scale, okay? And the impact has been extraordinary, okay? They've secured almost $12 billion in funding. They've entered into collaborations, J&J has, with 10 companies. They've seen 12 of their incubated companies go public. Another 12 get acquired. 25% have driven a product into the market commercially. A bunch are conducting clinical trials. So they are measuring innovation in a very clear, concise, powerful way. Okay? So again, I'm going to end one more time on this note from Dr. Glimcher, CEO of Dana-Farber. Regardless of what we do, right, it's a team sport. So as she said, it's all about cross-functional teams. But hopefully the thought that AI can actually be used to deliver more compassionate care is something that might resonate. Have my friend in the back, my skeptical friend, my doubting Thomas, have you been with me for this? Do you have any change in how you perceive AI as a result of our discussion?
I'll give 2 points.
Okay, I'll take 2 points, okay? I'll take 2. I don't know what scale we're on, but I'll take it. All right? All right. But again, go big or go home. You've got to think big, but start small. And I think that's the right transition, because what we're looking for now is to hear some of your ideas. And although we want to hear these ideas as big, changing ideas, we also want to see that you can operationalize these ideas, that you can show us that you can make a difference, even on a very small scale, and prove out your idea in a commercial way. So thank you so much.